there's a group of drugs called proton pump inhibitors. And they're, in dealing with the long-term care facilities, it's become as common with patients as a laxative, okay? Wow. Well, a lot of us old people, we have bowel problems, but not everybody has GERD or not everybody has an ulcer. But due to the good marketing on the part of the drug companies, they've become very common. The government has now stepped in and said, no, we are not going to be giving it to every patient coming in. And there's some statistics here I'll read that are just kind of interesting. 102 patients in this study, 36 or 35% were treated with PPIs on admission. Only 3 or 8% had a clear indication noted for this drug. And they come in and they give it to them because the doctor doesn't want to hear them griping about stomach issues. However, for the people that are, the administrators in that, there's what they call an FTAG. Medicare comes in when they're doing an audit, and the FTAGs are for various reasons, not cleanliness, missing a dose, or this sort of thing, but also the FTAG F3332 medication errors, or they're saying the use of an unnecessary medication, FTAG 329, and these FTAGs have fines associated with them.
Yeah.
So the proton pump inhibitors, Prilosec, any of the over-the-counter ones, Zantac, that are given very commonly, the government's now saying, are they really needed? And of course, the timing of the drug, they're paying attention to the timing of the drug. The drug should be given 30 to 60 minutes before a meal. And there's a very complex chart that somebody got creative in the government. They generated this.
Oh my goodness.
It's too small for the camera to pick up. But there's a key to unlocking it, and supposedly the pharmacist is the person who's going to do that. But, the pharmacist is not involved in a lot of these long-term care facilities, although we're going to be having an expanded role. But the FDA's been raising a fuss, and finally they said, okay, no, we're just going to hit the facility with an FTAG for improper use of the PPIs.
Yeah.
So I think that might be of interest to your folks, your audience.
Yeah, absolutely.
Okay, and another one that's kind of interesting, I just pulled off, lab tests. They're just doing way too many of the HB1ACs, which is the diabetic check. They feel that 5 or 6 times within 2 years is unnecessary. And I've been dealing with the new doctor, and it's sort of like, a handshake. Hi, here's, you got some blood tests, and one of them is an HB1AC, 3 of them in the last, 4 to 6 months,
Yeah.
Not totally necessary, especially in your stabilized diabetics. So we can go ahead and cut this one here now, and I've got one here that I'll probably have to do a little bit of reading on it because it's a relatively complex area. But I attended a talk in Washington, D.C., and it really has become a problem with the older people. And this is called anticholinergic overload. And the anticholinergics, one group of them are really relatively common. Chlortrimeton, over-the-counter antihistamine, Dramamine, motion sickness type thing, Benadryl. Let's see, what's familiar to you as an over-the-counter? Okay, the rest of them get into the medications. Benztropines used to prevent, we talked about the side effects of some antipsychotics. The benztropine is used for the gait problems associated with some of the antipsychotics. Dicyclamine, it's used for the GI tract. The hydroxyzine, Atarax, is used for itch and used for has some activity in the psychiatric realm. And also a common drug like the respiratory drug like Atrovent, the puffer. That has anti-cholinergic side effects. Muscle relaxant, Norflex, something for the bowel, oxybutynin or Drchris. All of these drugs that many of your patients are getting have anti-cholinergic side effects associated with them. Now, we're going to read it here so we get it complete, okay? Anticholinergic is a substance that blocks neurotransmitter acetylcholine and inhibits the parasympathetic nerve system. And by binding to the acetylcholine, the nerve fibers of the parasympathetic system are responsible for the unconscious movement of your GI tract, your urinary tract. You don't sit there and say, okay, I got to keep my bladder shut off so I don't pee, as long as you got a functioning thing.
Yeah.
Lungs, all the things. It's sort of like, I guess in a computer, RAM. It's operating in the background. And so it keeps your body going. And these drugs, since they block the acetylcholine, can have really serious side effects when you add them on. I read the list of common ones and ones that are commonly used in the long-term care setting. And they treat a variety of conditions, gastritis, diverticulitis, urinary problems, respiratory disorders. You just run right down the list. Insomnia, dizziness. And basically what happens is you end up with these side effects that pile on top of each other with your patient. Yeah. One doctor's taking care of the respiratory, the other doctor's taking care of a skin issue, and you have the problems that kind of hit the patients. And I'll just run through a few of these. It can have long-term mental effects. There again, people are they're cognitively disabled, so let's give them another pill. Their cognition's down. Well, why not drop a pill or two, and maybe their cognition will get better. The poor coordination, dementia, decreased mucus production in the nose and the throat. They've got dry eyes, they've got dry throat, dry mouth, which can result in dental issues. It affects the sweating, so they tend to get hyperthermic because they can't get rid of the heat. If you're not sweating, you're not getting rid of heat. They become sensitive to bright lights, the urinary retention. All of a sudden, but don't worry about that. We have pills for urinary retention. All these side effects that show up, we end up with another pill for it rather than looking and saying, what's going on? Why are these people having these problems? Wandering thoughts, inability to sustain a train of thought, incoherent speech, irritable medical confusion. All these happen not from just taking one chlortrimeton, but I read a bunch from there, and you can take like 4 of those and not even, you're treating each symptom appropriately.
For totally different stuff.
Yeah, and then all of a sudden your patient goes south and, okay, well, what pills should I give him now?
Yeah.
So this anticholinergic overload is huge in your elderly population because, as you can see, these drugs, the anticholinergics do have valid therapeutic uses. So it's something that we've become so busy in the medical field that the doctors you know, they don't think when they go to order something, oh, is getting another anticholinergic, you know. So they just toss the pill at them. I mean, everybody is very tunnel vision, you know, solve the problem.
Yeah.
And that's where it can pile up and cause a real problem to your long-term